Hello, welcome to my Women in Health Tech series. I'm Zeta Jhanji, lead data and analytics consultant from Digital Gurus Health, where I founded this series to provide just a different platform for the NHS and health tech sectors. Today, I'm joined by a real advocate of data within the NHS. But before I crack on with the questions, Ella, would you like to introduce yourself?
Hi, yeah, I'm Ella Worsdale. I'm the head of information for Pennine Care, which is a specialist mental health and learning disability trust in the east of Manchester.
Great, thank you. And I mean, I get a lot of women and men looking at the series for some inspiration and sort of surety on their journey, I guess. But Ella, how did you start out on the NHS and now end up in a head of information role?
I guess I probably fell into the NHS, not necessarily chose it. I was 24, 25, just kind of finished my gap year, had a couple of contracts and was looking for, I guess, a career, but wasn't totally sure what I wanted. But I saw a job as a data quality assistant at Pennine Care and thought that sounded okay. Went for the job, didn't get it. And actually got a phone call from the people interviewing saying, you haven't been successful in the data quality job, but we've got something at the same level, looking for similar kind of experience and skills, implementing our new PAS system, our new patient administration system. Would I be interested? And I was like, yeah, definitely. So that was my first introduction into the NHS. So from my first year in Pennine Care, I implemented a system called IPM, which is part of the National Care Record Service. And actually really enjoyed it because I got to know the services. I started testing systems out and kind of one of the first people to kind of play with the system in Pennine and got involved in lots of different bits, including kind of configuration of the system and got into play with spreadsheets. So I recognised in the first year that I was a bit of a nerd and quite like spreadsheets. And as kind of the end of the year came about, a role as an information analyst came into the vacant in the information team. So I thought, well, this could be a good move. And from a career perspective, I thought, seems like I might be into data. I was good at what I was doing. So applied and got the job as information analyst, and then progressed from there to spent a couple of years as an information analyst, then senior analyst, then started to manage part of the team, and then a team leader. And then the job's kind of grown over the last decade into kind of head of department as the kind of structures changed, the team grew, we took on more services, then we had production services. So the team's expanded from, there's about 5 people when I started to be a team leader, and now there's 17. So it's kind of just progressed and changed. And the data world has massively grown, and the need for information and reporting and data analytics and intelligence has grown over the last 15 years from where I started. So yeah, fell into it, and it's treated me well, and I've really kind of enjoyed it and still really passionate about data. So here I am.
Yeah, no, it's great, especially how you've definitely moved up through the ranks as well, which is really great to see, especially within the NHS. But I know when we've obviously spoken before, which was sort of first last year now, but you were really in the thick of it all, as like the go-to person within data at Pennine Care during the pandemic. What would you say something like the cultural shifts are that you've potentially seen in like the last 18 months when it comes to data? Because I know you have discussed like it had negative connotations, but it wasn't always seen as the light that it is in now within the NHS.
Yeah, it's been a really interesting 15 months, obviously very hard and very challenging. You could talk to probably any analyst and data person in the NHS, as well as obviously all the other professions. It's been a tough year. I think what's been great to see is, I guess, not just in the NHS, but outside the NHS, is the need to use data to understand what is going on. And as we know, we hear in the news every night, and in fact, on every website, a news website, you see charts and data everywhere. So we're flooded with data, and people that didn't used to look at data are now looking at it without knowing that they're really doing that. So there's been an acceptance that data is driving the decisions as part of the national pandemic. And in the NHS and in our area, the amount of data that was needed literally from day one of the pandemic to understand what was going on for patients, for staff, to make sure we could react in the right way, we knew what was happening. So the demand for data has massively grown, and and shifted the burden has grown on the teams who were already under pressure to provide lots of data. Obviously, the priorities shifted slightly, and also moving to kind of 7-day reporting. So a lot of NHS trusts, a lot of analysts have had to kind of support a 7-day reporting process, which has been pretty tough. But like most people you meet in the NHS, really flexible and really keen to support, and everybody kind of stepped up to support the pandemic. I think what shifted beyond kind of collecting lots of extra widgets of data is an appreciation that it's not just about looking back at performance, because it's very KPI driven area. We've got hundreds and hundreds of KPIs across the NHS that are monitored, but what has kind of changed in the last year and is really is actually using data, start to think about data to plan for the future, and doing that more than ever before, not just kind of looking back but trying to look forward. And not just for data people thinking about that, but actually the wider people who weren't always engaged in data in that sense, not always don't always see the value in what it can bring beyond kind of performance monitoring and activity and demand, actually thinking about how we can use this to understand exactly what's going on and start to really plan. Because this pandemic has shifted everything in the NHS, the way we deliver services, the way that the demands come through, the way that everything's changed, and the data is backing up how it shifted. So it's been looking at the data for our organisation, trying to understand what's happened over this last 15 months and trying to work out what will change in the future, because this has never happened before. And working in a mental health and learning disability trust where the pandemic's had a totally different impact compared to other sectors, is how can we predict when the demand might go through the roof, because obviously from a mental health point of view it's had a massive detriment to people's mental health. How can we predict what's going to happen? So it's a really challenging time as well, but there's a definite shift in the appetite and the need to use it for future planning, which is, from an analyst point of view, it's really good, because that's what we've been trying to talk about. It's what we try and focus on. We want to make a difference. We want to improve service. We want to make sure the patients are getting the care they need, and also to predict how we can reduce admissions or reduce self-harm or whatever it might be by using the amount of data that we've got. So, but there's more people looking at it in that way. So the appetite's changed, and therefore from a data strategy point of view, it's just kind of, it's been fortuitous that it's helping to kind of drive that change and recognition that it's absolutely critical to use data in that way for the NHS to do what it needs to do.
Yeah, no, definitely. It's interesting as well now, sort of this post-pandemic world, and what other organisations with like population health, how can we be looking at that sort of data? So that's when it gets really interesting. So yeah, it's good that it's had such a positive effect though. Now hopefully everyone will capitalise on this upward trajectory as well. But this sort of question, so when trusts are thinking of reviewing or creating their data and analytics strategy, what do you think the main things are that they should consider?
Well, fortunately, I've just reviewed our data strategy for Pennine Care and started to think about how to make sure it lands in the organisation. So many things you need to think about, because it's probably easy to think it's about something technology-wise. It's just about data, it's about technology, making sure we've got the right technology to support reporting and analytics and modelling or whatever, but it's far more than that. So in the strategy that I've been looking at and looking outside the NHS about what other companies and business and other sectors are doing around data analytics, how they get it embedded in a business to become data driven, so their decisions are informed by data and we know where we're going, and we're providing the best possible care we can for our patients. In terms of that strategy, it's about making sure, I've kind of pinned it on 6 areas. The vision and the ambition is really key, and making sure that's accessible to everybody, so everybody understands what that vision means, and using the right language to get people engaged with that and make sure people understand where we're trying to get to and why it's so important to have the strategy. So it's not just a chief information officer or a chief data officer saying, yes, we need data and we need a strategy. It's about everyone in the organisation at whatever level and whatever role really getting it. So that vision and strategy being really accessible to all, and everyone can kind of articulate it. The technology is really important, and that is a key element, and making sure it's flexible and robust to allow data to be accessible, allow data to be modelled and analysed, and make sure it's sustainable, because we need to make sure the technology is good enough. So we can't have a data analytics strategy based in Excel. that's just not going to happen. We need the right technology to do the jobs. So making sure it's really good. So tech is absolutely critical. The culture and the people is one of the biggest challenges and one of the most important things. From in terms of people and whatever role they're in, or whether they're a manager or not, understanding their role in data analysis and having the right skills to analyze and look at data, not just the analysts, and they need to make sure that they are developing in the right way so they can present data back, they can analyze it in the right way, but needs to be accessible, so they've got a certain job to do. But the skills of our managers and our decision makers is really important, so their data literacy skills is absolutely key, and you can't underestimate that shift in expectations. Is that a lot of clinicians who become managers, or a lot of managers that whatever role they came into into the NHS weren't necessarily data nerds and didn't start off in looking at spreadsheets and going, oh, great, is that we've got to make data accessible and make people want to use data. So data literacy is really key. So we need to support our staff to grow their skills as well as their digital skills, and can't assume that this is just something that everyone can just do. So making sure that's part of people's development in any role that they're in the NHS, to make them savvy, and to make sure they understand why it's needed and what they're going to get out of it, which is so skills and the kind of culture to kind of champion the use of data. So one of the things we've been talking about is really sharing the stories where we've used data to make a difference, or we've brought in funding or transformed services, that's really shared back with people so they can see what value it adds. Data governance, fairly obvious, but need to make sure the data quality is good enough, need to make sure that the data and the way that it's stored and processed is accessible and strong, so that it's not up for misinterpretation. So we've got to make sure kind of things like data dictionary are open and transparent to people. And in terms of data security and GDPR, I need to make sure, yes, the data is secured and used for the right reasons, but also make sure and it's available for the right people at the right time. So all them kind of data governance stuff we need to consider. The other two areas is about making sure the products we produce, the analysis, the data, the dashboards, or whatever how we're viewing the data that they need to make decisions on is accessible and as good quality as possible. It needs to be efficient and timely and accessible and intuitive. We need to get to the decisions really fast, so it can't be really complicated. You can't have, managers haven't got time to wade through lots of data that need help with getting to the answers fast, so making that really accessible. And then the final one is around kind of a prioritization or an operating model, the way that we process and decide what we're going to look at, what we're going to focus on. We're inundated with requests for information and data analysis, and it's sometimes hard to decide what's the most important things to look at. So as an organisation, we need lots of people involved in deciding what we should focus on and making sure we've got the capacity and the resources to support that. Because there could be lots of stuff that will have a massive return on investment in terms of outcomes for patients or bringing in extra income or whatever it might be. How do we assess that? And that's very difficult. Sometimes that is massively done in isolation in most organisations, where only a couple of people are making the decisions around what we should be focusing on and not recognising what else the data teams are kind of dragged into. And there can be a lot of time spent on doing national data sets and basic reporting, whereas the time we want to make sure they've got a capacity to do everything that they need to do, but focus on the stuff that's going to make the real difference and add the value. So the strategy is huge. It needs to be thinking about all them kind of angles. It's not, it can't be done overnight. Like I said, it can't be done in Excel, it can't be done on the back of a packet, and it needs to be really considered and thought through. But people, the culture is really critical, as well as all the other elements.
No, definitely. The last point was extremely interesting, because obviously you want the outcomes and the patients to, I guess you want every single thing to work seamlessly so that the outcomes for the patients obviously is where you envisage the most return on investment. So yeah, that's really key, really key. How long is that strategy?
It's not really long, to be fair. I've kind of making it accessible. So kind of the strategy we've got put into a presentation to start with, and there's an underlining kind of program plan and tasks and prioritization, and there's an establishment of a data committee and strategic lead from different angles of the organization. So I suppose it's big in terms of how much of a difference it could make, but making the strategy simple enough and also making sure it fits with all the other strategies of the organisation. And in theory, hopefully in a couple of years, once we've established our processes and the culture and making sure it's recognised, is that there isn't need for a data strategy. It's part of every strategy that we write. It's part of the business strategy. It's just data is part of that. it doesn't have to be separate. Until we get to that point, it needs to be. But I would say, hopefully in our ambition in Pennine Care, for definitely in 24 months' time, then we were in position just to weave it into everything, and that'd be part of the strategy.
Yeah, no, I completely agree. So it's a long one, isn't it? But I'm seeing more so now in terms of even like non-technical roles, even on the clinical side, because we obviously look at the healthcare pieces as well. They're all asking for like an insight into data from the people that they bring on. So it's quite interesting. But it all sort of ties into this overarching data strategy. So no, I like those points. And you're obviously a bit of a Tableau queen, which is great to see. But what would you say are some of the most beneficial technologies that you've actually been able to adopt over at the Trust?
Yeah, I mean, Tableau as a data person, trying to get a technology that really helps make data accessible through having the right technology to present data back to our decision makers, as well as having a really decent data warehouse to process data and all that, having the right technology. I think in the last year, one thing that I've really kind of championed, although it was provided to us part of the pandemic and the response for the NHS, is MS Teams. Obviously, loads of people have it's just naturally been adopted as a technology to have meetings and virtual consultations and virtual catch-ups or whatever. But there's so much more in that package that I've kind of championed in our team. So trying to reduce the number of emails and improve the way we communicate in my department to start with. So kind of shifted everything. Obviously, we used to be in the office and then we had to work remotely, to allow us to work really effectively remotely. I've really championed the use of MS Teams in our department, sharing our documents via the different channels and splitting things up. So we're using kind of like the project planners and the chat facility and all the kind of extra bolt-ons that come with Teams, far more than just the meetings. And then because I've seen it work in our team, and whilst we struggled as an organisation to adopt the technology and roll it out because of our capacity and IT pretty stretched at the time, I've been around and championed that in other departments. Say it works really well if you want to work remotely and work really effectively and reduce the amount of things going via email or the amount of phone calls or whatever it might be, then really champion the use of MS Teams, which is an obvious one in this pandemic world when everyone's adopted virtual technology. But I think it's about adapting it to support effective working, and we've been talking about it for years around having a technology where you can share and where you've got forums to share ideas, where you can share documents without filling everyone's inbox or filling network drives. So it's solving loads of problems, and it's kind of landed on a number of trusts that weren't quite there with it. But for me, like, it's always trying to find a technology that is solving a problem that we sometimes didn't really realize it was there, but it's kind of fortuitous. And I think for me, I like to see a technology and then I'm like working out what all the buttons do, even if someone's not told me. I'm like, actually, we could do that. So that's, I think, the virtual technology and the ability for us to work remotely now is huge for the NHS and huge for something I never thought I would see in my lifetime, to be fair, the way that we've adopted new ways of working, and it's been really good. So I always like to see that a technology is making a difference, and we'll champion it, because not everyone is inquisitive as me in a technology, or they're a bit nervous about pressing a button, whereas I'll just try and see. So it's kind of getting everyone else on board to see how it could work and then kind of bringing them along with us.
Yeah, no, it's so collaborative as well, and it's so much. You want something fast doing, you've got to put it on Teams, because an email could get lost in the amount of emails you must get through as well. But no, it's great to see. It's certainly such a good piece of tech. We use it all the time, so yeah, I'm a big advocate of that. And I guess in terms of that, obviously you mentioned about the MS Teams. You've obviously discussed that you've done some Tableau as well. I mean, a lot of Tableau. What would you say some of the main challenges you've had to overcome when it comes to implementing data or analytic changes, and how have you actually overcome them, would you say?
I think there's challenges at kind of every stage of most things, and it is really difficult. And whilst I've seen a really shift in the last year for the appetite for data and stuff, there's still a massive challenge in terms of getting everybody to see things in a similar way, and trying to acknowledge the capacity that people have got and the demands on people's job, because a lot of kind of, I suppose, use of data it's a massive culture shift. Our vision is to kind of make using data integral into people's day-to-day job, not kind of an extra that they'll do maybe once a month if they've got time and it feel like a bolt, and it's actually weaved into the way that they do the job to make their job easier, not harder. But the biggest challenge, I suppose, funding's always a challenge in terms of persuading the people who hold the money that the project or the technology or the implementation or the resource that you need to do something is going to make a massive difference, because sometimes we're doing things ahead of other organizations or other departments, so they can't always see it. So you kind of sell the dream, but until they see it, they don't know how to fund it, because it's a bit of a risk. So sometimes you've got to start really small and prove it. So I suppose for me, in terms of things like when we implemented Tableau, had to kind of prove it worked before we got full-on funding, which I think is justifiable, rather than jumping in and hoping for the best. Starting small, but sometimes not everyone's capable of doing that and is so able to do it in that way. But I think trying to start things small, test it out, prove it's worth, try and make sure that you've got the outcomes delivered. So what are you trying to deliver, and then prove the outcomes work from a data point of view. You should be measuring every kind of quality improvement project with data outcomes or measures of evidence. So kind of fits really well with this kind of environment. I suppose the culture and the people is always a challenge, because as I've said, everyone's busy, everyone's got a slightly different angle of stuff. So I think the way that I've kind of approached it over the years, and it has been a challenge, is to try and make a link into their role. So when we talk about data with different roles of people, is trying to get them to connect to it by presenting data that's related to them or in their role, or how it will make their jobs easier. So trying to get to understand what their role is and what their challenges are, and then kind of weaving in a discussion around data about, well, actually, this could help you. So I think I've always tried to kind of understand their position as well as my own, and then hopefully help to address that. Doesn't always work. And I think generally being passionate about what you do, I think what people would say about me is I'm really enthusiastic about what I do, and that kind of rubs off. So people come into meetings, I've done workshops where the first question I've asked, like as a poll, is like, how much did you dread coming to a data meeting today? And everyone's like, yep, we all dreaded it. And then at the end I'm like, so how much did you actually get out of this? And they're all like, generally like, yes. And it's certainly flipped it. And it's interesting to see that you can actually get people to engage in a subject that's sometimes people would assume was dry, that it's not, and the difference it can make. So I suppose being passionate, challenging, starting small, lots of kind of ways that I've kind of tackled stuff, and being tenacious and just standing my ground and trying to push it through even when people have kind of pushed me back, in a positive way, not in a forceful way, but in a persuasive way, and just kind of keep kind of reminding people the benefits. So it can take a lot of time, and not giving up if you believe something.
Yeah, no, it links back to as well how you got everybody on board with teams and showing them what can actually be done. And people, once you've actually shown them something, they react so much more. And once it's more visual, but I appreciate obviously getting to that point when you're implementing new technology can be challenging. So no, they're all really good points. And imagine those meetings, you get engagement straight away from asking that question, because there's no sort of shying away from it. So yeah, really good points. I'm sure a lot of people will be jotting that down on this anyway. And that sort of leads on to my next question, because you've played quite a huge part in the Northwest community across Tableau, healthcare, user group meetups, and Her Plus data. Why is that so important to you?
I think for me personally, in terms of motivation and making sure I'm doing the best job possible, networking is so vital in that. And I think up until about 6 years ago, I was like, I need to network, I need to grow it, but I was a bit nervous, didn't really know where to start and stuff. And then I suppose kind of getting involved in different technologies and meeting different people, my network's just grown. So getting involved in groups like running the Tableau Northwest User Group has expanded my network beyond the NHS to data people across the world, in fact. And then getting involved in Her Plus Data, just kind of being able to connect with all these different people from different kind of places and slightly different roles and stuff. It's great, because I like sharing what I've done, because I don't think everyone should have to reinvent the wheel. And when people have shared it with me, and then I've kind of taken their ideas forward and stuff, and how much benefit is when you just share it rather than everyone trying to do it in isolation. There's a lot of insular work, and it doesn't really work. Whereas actually sharing with others who then share back, your knowledge just changes and your motivation levels just grow. So then you do a better job. So it's just the opportunity to share ideas and meet people and be motivated. And also for me, I suppose, to be involved specifically in the kind of the female data groups like Her Plus Data. And I'm not actively involved, but try and support it. And I've been to a few groups and met lots of people. And one of the challenges that women face is about that kind of having role models and knowing that it's possible to be a more mannered and a leader and a senior leader as well, and working in the NHS in data world and male dominated, they want to be able to see that it's possible. So I think as a senior leader with a family, I've got two boys. I've managed to juggle being a mom. I've managed to progress my career, done really well. So it is possible. Yes, it's not dead easy, but at the same time, it gives me that balance and it gives me that appreciation. But I want to show people that it's possible too. So I think being involved in these groups is really important to show that the women can do what they want to do and they should be part of it because they're vital. So I think for me, being a role model is really important, but part of being a network is really vital for me as well in terms of my learning and my growth and my ability to bring lots of ideas into the roles I'm in or into the company that I work for and into the NHS. That's really important. Like, I don't know everything, so I need to go out there and find out what works best. So why wouldn't you ask somebody else?
Yeah. No, of course, because I remember after the event you spoke at for me as well in December, you got was it 3 mentors off the back of that as well?
Yeah, three people reached out for me to be a coach, and I'd offered it up, but that was just so I suppose heartwarming for me that people, after listening to me waffling on about whatever, that people feel like they can approach me and get something out of that relationship. And I get a lot out of supporting other people. I really like being a coach and a mentor and stuff, because just seeing people grow or learn without kind of people just want support, whoever they might be. Everyone needs someone to talk to and know what's possible. But yeah, that was brilliant. Yeah, and they're all fab ladies.
Yeah, no, that's great to see. And I guess as a final question, because obviously you've had an incredible career, but you are not stopping anytime soon. But what would any advice that you would potentially give to your younger self starting out?
I think, and someone said to me recently, and it stuck with me, is being brave is one thing, and really kind of sticking your head up a bit and kind of don't let things happen to you. Take charge of your situation, look at opportunities, create a network. Definitely, if I'd known kind of the value of meeting lots of people from different environments and chatting to people 16 years ago, when I was very shy and probably wouldn't even talk in a meeting, and when I talk about I need a network, well, if I'd known what I would have got out of it back then I totally would have. I don't know how easy it would have been, but I definitely recommend it. So if there are groups you can go to, starting chatting to people, reach out to people. People are far more approachable than you think they are. Drop them a message on LinkedIn and I'm always like, hi, and people do that all the time. So just be brave and reach out to people for support and just stick your head up and just kind of be noticed in a positive way. So there's lots of people who may work at certain places and they might not know you, but show people that you're good, celebrate what you do, reach out, get feedback as well, request feedback. I think a lot of people think that they don't get that enough, but you've got to ask for it and you've got to ask it in the right way. So try and get feedback around how you want to progress. And I would have got a mentor and a coach back then, definitely, to help me kind of do better than I did, I suppose. But I had lots of good people around me. But yeah, stick your head up, get a coach, network, and be brave.
Love that. Thank you so much. Thanks so much, Ella. It's been great chatting with you, and I hope everybody has taken so much from this.